I think having this reopening advisory board get to work, and by the way, they're going to be working every day, right? Since we no longer have days, they're going to be working every day between now and the 18th to discuss both the larger issues associated with the regulatory framework, but also the operating principles and the policies around how to regulate, enforce, and oversee, which is what we're really interested in having our municipal colleagues help us think through, so that when we get to the 18th, there will be guidance that we can make available to people. And remember, this is a phased opening. Phased. It's not going to be everybody all at once. I'm sure many people would like to see it happen that way. Others might not. But the bottom line is this is going to be phased. And it's going to be based to some extent on those businesses that are most likely to be successful coming out of the gate with respect to a reopening of some sort. I mean, that is exactly how, by the way, most other states are doing it.
Do you think there's a chance you might have to extend it again?
This morning, can you talk a little bit about the conversation that you had with him, and also did that factor into your decision with coming up with this May 18th date?
No, but I talk to Mayor Walsh all the time about all kinds of things, and the May 18th date has a lot more to do with the running room we felt we needed, first of all, to get this work done, but secondly, to recognize and understand that while we've gone up like this, we've been like this for a while, and we have not seen a downward trend yet on a number of those key metrics.
Do you think there's a chance we may have to extend again if this plateau does not start to come down?
The one thing everybody in public health and everybody who's been making recommendations and providing guidance on this has said is that until you see some downward trends for some period of time, and it varies how long people talk about those downward trends, but the bottom line is if you don't see any downward trends, then you are running a terrible risk by walking away from what is known to be a very effective strategy to slow the spread, which is the distancing and the limiting in mobility. And I get the fact that it's hard, and it gets harder as the weather gets nicer, and it gets harder as the time gets longer, and it's especially hard if you're out of work or if your business isn't able to operate. But there's literally no one in the healthcare world or the public health world or the infectious disease world who thinks you can open the door and put people back into working environments if you haven't seen any negative downward trend on a lot of those key measures. And right now, we've basically flattened it, no question. But in terms of seeing the number move in a positive, negative direction, we haven't seen that in most of the metrics that we've been looking at yet.